Deputy Speaker. 3 months ago, one of the UK's most eminent and trusted cardiologists, a man with an international reputation, Dr. Asim Malhotra, published peer-reviewed research that concluded that there should be a complete cessation in the administration of the COVID mRNA vaccines for everyone because of clear and robust data of significant harms and little ongoing benefit. He described the rollout of the biotech Pfizer vaccine as perhaps the greatest miscarriage of medical science, damage to population health, erosion of trust in public health, and attack on democracy that we will witness in our lifetime. Interesting, Madam Deputy Speaker, there's not been a single rebuttal so far in the scientific literature to Dr. Malhotra's findings, despite its widespread circulation and it making international news.
Hello, and welcome to NSG. And this is the Hot Seat, where it's all about country and people. Welcome. I'm your host, EAMN. In the interest of Ghana must work, Ghana can work, we want Ghana to work. Please subscribe to the channel, like the video, and forward to other Ghanaians. Today, we're talking about vaccine, even though personally I'm careful to call it a vaccine. So let's say the COVID injection. I came across an article in the businessghana.com news, and which, of course, I will read some captions, and then we will look at it with respect to what is going on around the world, to where even this injection came from. COVID never originated from Ghana, neither did it originate from Africa. Yet, all these cortices or the areas in the world where these issues started from and was very, very interestingly deep, have all withdrawn and have pulled back on all the draconian measures that were put in place. But it's quite surprising that Africa and some of the African countries, including Ghana, still playing some funny games with the situation. So I came across this, and on the hot seat, we want to have a look at some aspects. And at this point, we want to say, is either the Ghanaian Ministry of Health leadership is compromised financially as far as the COVID injection is concerned, or they just don't know what is going on, or they just don't care about the health of Ghanaians. So let's get into it. Now, this is what the caption says. Reducing vulnerability. Ghana Health Service encourages COVID-19 vaccination. I call it COVID-19 injection because at the heat of the COVID story, the lockup, the lockdown, whatever you want to call it, it was more or less like the world was being stopped from having any other view, perspective, medical advice as far as what was going on is concerned. But here we are, all these things that were being said from experts, virologists, doctors, physicians, nurses, they are now being vindicated. I mean, testimonies from some of the officials from some of the pharmaceutical companies has vindicated them. And so it's quite surprising that Ghanaian medical sector leadership is still pushing for this. And even in some instances I came across, the Minister of Health is actually demanding that if you don't show certificate, you don't have to access the Ministry of Health facility. That is ridiculous. Is it that he's compromised financially and want Ghana to buy more of those vaccines that we have even signed ourselves? You ask yourself, at the peak of this matter, at the heat of it, countries have signed to indemnify the companies that were manufacturing this vaccine. My intelligent mind tells me, no, something is wrong. Is it that they are not confident of what they are offering us? Or something is wrong, they knew about it, and they don't want to be held accountable. Imagine buying a car and the shop says that, look, you have to sign to say when you get on the road, in the next 5 minutes, something happens mechanically, which points to the fact that the manufacturer has made an error. They are not responsible. I believe you would think twice before buying that car. But anyway, so one Dr. Kwame Amposa Achiano, manager of the Expanded Program on Immunization, EPI, of the Ghana Health Service. He says that the country can reduce its vulnerability to the ripple effect of the current growing COVID-19 cases in other parts of the world if eligible persons for vaccination avail themselves. Who are these eligible persons? They didn't say. I will stop there. Now, in some other courtesies, it is said that as far as Africa is concerned, this COVID-19 virus has already spread to the whole Africa. So it is said that the mass majority of Africans have natural immunity against this disease. In some other courtesies, it is said that whatever countries that are still injecting individuals with this jab are actually injecting them against nothing, because the virus has mutated. It has gone from what it was to different thing now. So any vaccination or injection has no protection against these things. Not only that, the pharmaceutical companies, their representations, I think during the European investigation about a lot of things that went wrong or informations, of course, they call it misinformation. Actually, we were misinformed or deceived, lied to, for whatever reasons. Yet Ghanaian leaders are sitting down there that to reduce vulnerability, Ghanaians should avail themselves for this injection. It is either they are financially compromised, they don't know what is going on, or they just don't care about the health of Ghanaians. That's the first gentleman, Dr. Kwame Amposa Achiano, manager of the Expanded Program on Immunization, EPI. Let's carry on. Let's fast forward quickly. Now, prior to that, there is a doctor on YouTube that keeps updates consistently on this matter and has given some very interesting, sometimes worrying statistics of what is going on. Even though personally I have issue with this, our Health Act, due to some aspects that I read, that begs question, let's accept it for now. The Health Act 851. The Health Act 851. Under Section 25, subsection 1, subsection B. Vaccinate that person unless satisfied that the person is already successfully vaccinated or otherwise has natural immunity to the disease, or unless the vaccination will be injurious to the health. There's already evidence around the world. Families have reported of people took this injection on the same day, a day after, 2 days later, 5 days, 4 days, a week later, in some cases casualties. There's a lot of reports now, even on the CDC website, that there are heart-related issues that are coming up. Is that not injurious enough for the Ghanaian medical officers or the leadership to begin to do their own research to come to a conclusion if this injection is consumable to Ghanaians. Again, is it that they are financially compromised? They don't know what is going on? Or they don't care about the health of Ghanaians? That's the Health Act I read out to you. Yet, our Minister of Health is saying that this very injection that is raising questions about what it does to human beings, he is demanding that the staffs at the Ministry of Health, except they have it, they will not access the building, even in 2023. This is the hot seat, where it's all about country and people, for the betterment of Mother Ghana. Something else to point out for the Health Act before I continue with the captions and make few comments and we are out of here. But then it's quite appalling. Section 21, subsection 2. One, the requirement to vaccinate does not apply where vaccination will be injurious to health. Again, injurious to health, or where there is satisfactory evidence that a person is already successfully vaccinated or otherwise has natural immunity to the disease. There is reports that Africa has survived this situation without much injection. Therefore, the disease has already spread through Africa. And mass majority, if not the whole population of Africa, including Ghana, have natural immunity. Why is the Ministry of Health, Ghana Health Service, why are they not setting up the structure to check if Ghanaians are already naturally immune before injecting them with this very injection? Apart from the fact that the injection is labeled to have the tendency to cause injury. What is wrong with us? So your own Health Act that has the requirement that if an individual is naturally immune to a disease, he or she is not required to take an injection in the case, of course, vaccination. But by the definition or by the assertion and the information is coming out, this COVID injection does not protect, neither does it prevent. In some instances, it's even said that the health risk associated with taking the injection is higher than being exposed to the disease itself. Don't be naive. Don't fool yourself. Go and find the information before you follow these our leaders blindly and cause yourself harm. If there be any, I think there are, because I've known friends and I've known people who have given very unpleasant reports of taking the injection. Let's carry on. Then, this is on Ghana World. Reduction in COVID-19 vaccine uptake worrying. And who is this? The Director General of Health. The Director General of Ghana Health Service, Dr. Kuma Abuaji. I have actually called this Dr. Kuma Abuaji at the peak of the COVID-19 vaccine when he was mandating this thing with his press release. I called him out. But here we are. The very thing that I spoke about has become. And if he thinks he's not liable, he is. Evidences are proving that it seems Ghana Health Service, Ministry of Health, is not doing their homework. They are just accepting everything holistically as passed on to them from wherever it is being passed on to them. Where are our medical officers? Where are our doctors? Where are our scientists? Where are our virologists? Are they all compromised? Or they don't care? Don't put Ghanaians in harm's way because of your stomach. What did Dr. Akuma Buaji say? Or what is he saying? He said it is worrying that Ghanaians are not taking the COVID-19 injection. Of course, they are reading, they are listening, they are hearing from all around the world. Even though you, who we have appointed and mandated to look after us, you're refusing to do so. For whatever reason, yes, Ghanaians are intelligent and smart enough to source information from other courtesies. This is why they will not touch it even with a quarter meter pole. That's why they will not. So if it's worrying to you that Ghanaians are not taking the injection, you should be doing your homework, asking the right questions, creating the situation where investigations are being made properly, scientifically, to justify if what we are accepting is worthy of use. This is the hot seat, all of our country and people. Now, that notwithstanding, on the 1st January 2023, the Ghana Health Service has a press release. And what is this press release? I'm not going to read all of it. Signed by who? Signed by the same Director General of Ghana Health Service. The last paragraph, we want to use this opportunity to encourage all Ghanaians who have not availed themselves for the COVID-19 vaccination. I call it COVID-19 injection because it does not qualify to be called a vaccine, to do so. Those who have taken their first dose are to go for the second dose. After how many years? And those who have not taken their second dose are also entreated to go for the booster. But already it is said, if there be any, the variants that is going around, any previous COVID-19 vaccination cannot protect against it because it does not have the virus. The disease has mutated, has moved on. In some countries, this same COVID-19 is now downgraded as to be treated as a normal flu. What is wrong with our Ghanaian leadership? Is it that you're compromised financially? You don't know what you're doing? Or you don't care about the health of Ghanaians? And that's a shame. And it's unacceptable. And if with time it is proven that you're deliberately doing this for your personal gains, some needs to be prosecuted. Because I'm aware that there is even a friend whose daddy died after he took the job. Negligence. Now, not only the person saying it on the hot seat, you just open your ears and eyes and don't be ignorant, stupid, and foolish, and you will know what is going on. Don't trust these our leaders. Don't trust them. They are driven most of the time by their stomach, even though they are not hungry. Selfishness and wickedness. I am your host, the Hot Seat, M. Then here comes the Minister of Health. Ministry of Health declares no vaccination, no entry on the 2nd of January 2022, where countries like United Kingdom, US, Europe, these countries are beginning to investigate where they got it wrong by accepting and allowing their whole population to be injected with an injection that is yet to be proven what it does. The only thing proven so far about this injection is it's causing harm to people. Myocarditis is one of them. I can continue with the list. And our Ministry of Health, the same minister that procured vaccination without the authorization, is still standing there. Is he financially compromised? There was demand by Ghanaians for him to be removed or resign. That same person is coming telling us that if the staffs of the Ministry of Health do not have evidence that they have injected themselves with this thing, they will not have access Okay, where is the provision within the Health Act that says that if you're naturally immune, you're not required to? Is the Ministry of Health setting up facilities for Ghanaians to be tested for natural immunity? What is wrong with us? Came across a document, Republic of Ghana, statement by the Minister of Health of Ghana, Honorable Kweku Agyeman-Manu, on the ending this pandemic. He went to give a speech somewhere in Geneva, Switzerland. 17th World Health Assembly, Geneva, Switzerland, May 2021. As of May 2021, they were talking about ending the pandemic. And yet this man, as of January 2023, sitting down there telling Ghanaians that if they don't inject themselves with this thing that is raising a lot of eyebrows and questions, and vindicating individual doctors, virologists, people like Dr. Eden, that was vilified, criminalized as a bad man, even though he was sounding warning. People like Dr. Malone, who was the brainchild of what it is that is being put in your body, that he warned about it. They were vilified, now being vindicated. Because what is and what is, it is. You can deny it all you want. A fact is a fact. Truth are truth. Again, Honorable Kweku Agyeman-Manu, MP. Ghana Health Service holds a COVID-19 post-vaccination review meeting. A meeting? No, you should be setting up an investigation committee made up of virologists, doctors, physicians, scientists to study what you are injecting your Ghanaians, our Ghanaians, we Ghanaians. What was this meeting? To find out what went right, what didn't. And this is it. The Ghana Health Service, through the expanded program on immunization, is holding a 2-day review meeting in Kumasi to take a stock of what worked well and what failed. Nothing worked well, everything failed, if you care to know. 2, what the service can do to improve the COVID-19 response. The lockdown in Ghana was unnecessary, even though now we can see how vicious it is to our economy. How halting the economy suddenly and wanting to restart it. You see what it has cost us? Something that didn't start with us. And we were not vulnerable to it, but driven by our stomach because dollars were dangled in front of us, so we have no option but down to participate. And here we are. And Professor Hank is always on the internet telling us how our city is not performing well, how our inflation is going up, purely because of the lockdown. Everybody is in denial. The problems of inflation around the world is because of the lockdown, the senseless, humanless lockdowns that took place. 3, the best way to implement these activities moving forward. Which best way? Which best way? When you refuse to find out, verify what you are injecting Ghanaians, to set up your own institution, to find out and prove. Where is our drugs board? What did they do to prove that this is viable or is wholesome for Ghanaian consumption? Anyway, we thought to raise this because even in the United Kingdom Parliament, they were debating the issues around the vaccination, the concerns raised by the people of the United Kingdom. The same thing is going on in America. The same thing is going on in Europe. And Ghana is sitting down there, still pushing it on their Ghanaian. Maybe we are not worthy of anything, so we can die. We can suffer from whatever it is that this injection causes. It's a shame. We thought to talk about it. Till we come your way, God bless Mother Ghana. Long live the Fourth Republic. And for your own good, do your personal research. Because it seems like our leaders, from the Minister of Health right down to the Director General of the Ghana Health Service, don't care about your health. They don't care about what you put inside your body. Make your own decision. Your body, your choice. Stay blessed. Stay healthy. Till we come your way. God bless Mother Ghana. Long live the Fourth Republic.